Okay, good afternoon. My name is Jenny Ruffy. I'm a student at Passaic County Community College, and I'm here to interview you today. All right, so I'm just going to begin by asking you a few questions. And just so you know, I'm just going to be referring to this patient by last name as she chooses to keep her first name private. All right, now, do you have any family history of mental or emotional illness?
I think so.
Okay. So no history of depression, schizophrenia,
Mm-hmm.
any history of substance abuse, such as alcohol, drugs, anything like that.
Oh, for my two brothers, they like to drink some whiskey. They like to drink like at nighttime, and even in the morning. That's why probably my brother has been, diagnosed as the what do you call this? For the he had the what do you call this now? For his liver disease. He's
Okay.
been drinking.
So, so there's a history of cirrhosis of the
Yeah,
liver.
yeah. He died with that. And stage liver disease.
Okay. Any family history of accidental injuries?
No, no accidental injuries.
So no older adults have any history of falls
No.
or anything like that.
Mm-hmm.
How about surgeries?
Mm.
And this can apply to yourself as well. So if you've had any surgeries or anyone in your family has had surgeries, you could be able to.
Okay. Surgery. The only other I had surgery is my for my bunions.
Okay.
Bunions.
And what
And
exactly did they do to the bunions?
they had to remove the bones sticking out on my with the hallux. You call it hallux.
Okay. Any any family history of alterations in vision or hearing?
Oh, for my mother and father had for vision, probably with a vision problem.
What kind of vision problems? How would you describe it?
Just can see clearly.
Did they use glasses or
Yeah, they use
contacts?
glasses, just glasses. At that time, they don't have any contact lenses,
Okay.
just glasses.
Did any of them ever have any surgery to improve their vision?
No, no surgery.
Okay. And any history of alteration in mobility? Anybody have to use adaptive or assistive devices, wheelchairs,
No,
canes,
no, no one in the family that ever used the canes or wheelchair.
walker?
Mm. Oh, that talking about walker or canes. My brother-in-law, not my brother-in-law did use and still using cane. My brother-in-law. Mm.
Okay. All right. All right. Now, for example, you discussed how you had two brothers that had a history of substance abuse with alcohol. How did your family respond to those health problems that your brothers had?
Oh, they're very unhappy about it, you know,
In what way were they?
because like all the time you see they're drunk, you know,
Mm,
they get abusive, sometimes.
yeah. Did anyone ever, initiate any try to get them any kind of help, such as, you know, such as counseling or therapy
No,
or
back home,
addiction specialist?
no. They just continue to drink because they're retired.
Okay.
Oh, the other one is retired. The other one is not. Mm.
Okay. And these problems began when they were older.
Yeah, like what age did they retire? Like maybe 40, 40, 45,
So the drinking
45.
started
So
around.
40 to 45.
So that's when the drinking started.
Yeah.
Okay.
Or earlier because he died when was it? 49.
Okay. Now, when you say back home, what home are you referring to?
My hometown in like Solano, Solano, Nueva
Okay.
Vizcaya. It's in like 7 hours away from the city,
Okay.
Manila.
Manila, Philippines.
Yeah.
Okay. All right. Now, how would you describe your current health status of your family? And feel free to include yourself in that assessment.
Oh, there's
Overall, how would you describe
overall
their current health?
up there.
Okay. What makes you say fair?
Yeah, because like there's back home they have the only one that's thing is like the high blood pressure, cholesterol. That's mostly everybody had that.
Okay.
Hmm.
But everyone is managing
Yeah, they're taking
managing it with
they're taking
medication.
they have their maintenance.
Okay.
Yeah, taking the medic, taking like eat healthy food. Mhm.
Okay.
They take care of themselves. They're very mindful of their what they eat. Like
That's good. All right. Now, who is the person that monitors the family's health?
Themselves.
So they all
They-
self-monitor?
yeah.
Okay.
Uh-huh. And they go to the doctor too.
So they have
They visit the doctor like maybe every year, not like here like you have to go like every 3 months for blood work. Mm.
okay. All right. Now, let's discuss a little bit about your own personal health practices. I'm just going to ask you a series of questions and you can answer yes or no. And if you want to elaborate or clarify, feel free to do so.
Okay.
Okay. Do you exercise 2 to 3 times a week?
No.
Okay.
Mm.
Do you practice breast exams on yourself?
Sometimes
Okay. How often would you say you do that?
maybe once a month.
Okay. How do you make health promotion decisions? Like, how do you decide what's the best thing to do to improve your own personal health? Perhaps do you speak to your physician, to your family members? Do you just make decisions on your
I'll
own?
talk when I go to my family doctor. I'll ask a lot of questions like what do you have to do. You have to do. You have to keep. Have to check on for for my like if I'm dizzy. You know,
Okay.
I ask them why. Yeah, you have to like just get up slowly.
Okay.
And for my the rest of my blood works, you just continue. You have to continue taking my medications. Mm.
Okay. Now, in have you experienced a life change in the past year, such as new school, new home, the addition or loss of a family member, or a change in your health?
Yeah, I'm just thinking for my health. It's like you're getting older. Everything's coming. all the sickness is coming out. Just probably that's the age.
So specifically, what would you say has declined in your personal health?
I decline.
Just general feeling of health. You
Yeah.
feel less healthy, more tired.
I think, as you go older, you feel everything's going down. You're like everything.
Yeah. All
My
right.
sight, sometimes I cannot see that clearly, and sometimes I'm walking so slow, always get tired. What else? Gaining weight.
So, how do those things make you feel when when you think about the the decline or
Oh,
the,
I
you
don't know.
know, or just seeing your body, you know,
Deteriorating.
deteriorate, and not such a, deteriorate in the sense that you notice the change in your health.
Yeah. Mm-hmm.
How does that make you feel, like
I
when you
feel
say that?
bad. I said, oh, I feel so bad. That probably because I'm getting older. You know,
Yeah.
you're getting older. It's this how many second generation, third generation. You know,
Yep. Okay. All right. Now, what words would you use to describe yourself?
describe myself. I'm old. I'm going down.
Oh, can you think of any positive words that you can use to describe yourself?
Describe myself as helping everybody.
So you're a caretaker. You take care of others. Is that right? Is that a good way to describe it?
Yeah, family back home.
Okay. What would you say you're especially good at?
Very good at just you know just helping other people.
That's something very good to be good at. Helping others. Okay. Is there something that you worry about? What do you worry about?
About how long I'm gonna live.
Okay. Okay. So would you like to take a moment to breathe and collect yourself before we move on?
That's okay.
Okay. All right. All right. So I'm just going to ask you now a few questions about your your family and your household. How would you describe your neighborhood and community?
My neighborhood. I don't even have. My neighbors are all. I don't even have time, or I don't have time to talk to my neighbor. But
So you have a very busy
yeah,
lifestyle.
yeah. But it's quiet. Our neighborhood is
Quiet.
quiet. Yeah,
Do you feel safe there?
yeah, safe at night.
Okay.
I see people. My neighbors are all nice, but didn't have time to talk to my neighbor. But I feel safe in my neighborhood.
That's good. Okay. And what about your community and its like, as a whole? Um, how would you describe it?
The community. It's okay.
Okay. Now, what type of home do you live in?
Uh, Two-family house.
Okay. What floor do you live
I
on?
live on the first floor, and second floor is being rented.
Okay. Who lives in your home with you?
Uh, Robert Glazer is my significant other,
Okay.
and his daughter Sarah,
Okay.
and other daughter is in LA living right now, going to school for makeup.
Okay. How many members of your household are currently employed, and what type of work do they do? So let's start with the first question. How many members of your household are currently employed? So right now, we have 3 household members living in the home.
Mm-hmm.
Of the 3, how many are currently working?
Uh, One.
Okay.
That include myself.
You can include yourself.
Oh, and myself. So
So
it's two.
2. Okay. All right.
Sarah doesn't work. Just go to school.
Okay. Um, so what type of work do does the first member of the household do?
He's a warehouse manager
Okay.
for a fire extinguisher.
Okay. All right. And what type of work do you do?
I'm a retired nurse, and I work per diem in a hospital in Newark.
Okay. All right. Now we're just going to discuss a little bit about your family dynamics, um, and we're just going to answer a few questions with regard to that. Who makes decisions, particularly in areas of finances, and leisure time? So who's the real decision maker when it comes to those type of things?
In both.
Okay, that's good.
Okay.
Equal decision makers. So
Yeah.
that's going to be between yourself and your significant other, or
Yes.
okay, okay. So who is a primary caregiver to children or any handicapped family members? You can also, if this question does not apply to your situation, you can also indicate that.
What question did you ask?
Who is the primary caregiver to any children or handicapped family members?
Oh, Robert Glazer.
Okay. Would you call him nurturing?
What do you mean?
Nurturing, like, is he the nurturing figure in the family? Say, for instance, if someone is feeling ill or needs help, is he the one to tend to that person's needs?
No.
So who has that role in your household?
Me.
You. Okay. All right. Who would a family member go to with a problem? So,
What kind of problem?
well, it's not very specific to the type of problem, but if you, let's say, for example, if one of your family members has a problem, who would they go to?
To me.
They would go to
Yeah,
you.
they go to me. Yeah.
Okay.
If I can solve it, then
You will.
yeah.
Okay. How does your family cope with problems?
I mean, family cope with problems.
When they have a problem, how do they handle it? Do they get anxious, nervous? Do they resort to unhealthy behavior like substance abuse, drinking, or abusive
No,
behaviors, or
they could
they
cope up
talk about it?
eventually.
Okay. So they would talk about it?
Yeah. Eventually talk about it eventually.
Okay. So, have you lived in the United States for less than 5 years?
No.
Is English your second language?
Yeah.
Okay. Okay. What kind of recreational activities, hobbies, interests, or sports do you like to engage in? And then, if you will, just tell me how often and with whom.
Oh, like bowling.
Like bowling, okay.
Yeah, bowling like once a week. But right now we quit bowling.
Okay. So, do you have any other activities that include
Mm,
sports that you like to
to
you like to
go.
take a you like to be a part of, or
No, the only sport I like is bowling.
okay. What about watching sports?
Yeah, we watching sports. Like baseball, football. I love to watch those.
And who do you watch it with when you
With Bob.
okay? And just to clarify, that's your significant other?
Right.
Okay.
Mm-hmm.
Okay. Now this set of questions is going to pertain to your culture. You indicated that your hometown is in the Philippines. So
Mm-hmm.
these questions are going to be directed to your upbringing and your cultural beliefs.
Mm-hmm.
Okay. Do you believe in folk medicine, faith healers, witches, voodoo, anything like that?
So when was back home, they sometimes they go to the healer, fake healer.
Okay.
They help sometimes. I think
Okay.
when I was little back then, and medicine. If it won't work, you go to if we go for to the fake
Mhm.
healer. If it doesn't work, then you go to the medical doctor.
Okay. But your family has, or your family has engaged in practices where they sought
Yeah,
alternative.
yeah, that was years then. I don't know now.
Okay. How is your diet influenced by your culture or your religious standards?
I'll be dying.
So, for example, the kind of food that you eat today,
Mm-hmm.
is it food that's specific to your culture, or do you eat certain foods or not eat certain foods because of religious beliefs?
No, you just eat anything as long as you like it, you know,
Okay.
and just watch what's not good for your health.
Okay. So you're conscious of what you eat based on your
Yeah,
health.
yeah.
Okay. Do you include any um, family members when you're making decisions about your own health?
Yes.
Okay. Okay. Do you seek clergy or religious leaders when making health related decisions? Do you consult a priest or anything like that?
No. Sometimes I have a brother priest, and I just talk to him occasionally. Like,
Okay.
we have problems. If I feel so down, I just talk to him.
Okay. Okay. just some other questions with regard to your activities of daily living. Now, are you independent in the following areas? I'm going to ask you. Just indicate yes or no if you're doing these things independently or if from time to time you need a little assistance. Okay. Um, do you bathe yourself completely on your own?
Yes.
Okay. Are you able to dress yourself without assistance?
Yes.
Can you go to the toilet, get clothes off and on, and perform any hygienic needs on your own?
Yes.
Do you ever need help getting in and out of bed?
No.
Or, okay. You can still control your bowels and urinary tract at this point?
Yes.
Okay. And you can self feed without the assistance of another person?
Yes.
Okay. Now, is there um, any particular area of your life or any particular stage in your life that you wish you could have done differently or gone back to, in the sense that um, do you feel self fulfilled at this stage in your life? Do you feel like you've done everything you've needed to do to feel happy about your life at this stage?
I think so.
Okay. Do you have plans for the future with regard to when you officially stop working and are fully retired? Do you plan in terms of if you're going to continue to live in the same area, the same home, or if you're going to return to your home country? At this point, what do you think?
At this time, no, I don't want to go back yet, back home.
Okay.
I want to go. I wish I could still go around the world,
Okay.
you know,
So you have plans to travel.
to travel, to see
Okay.
other countries.
Good.
I've been seeing Europe. I want to go to Europe. That was my dream to go to Europe.
That's a wonderful aspiration. Okay.
I want to go travel, see Europe first, at least.
Mhm. So would you consider yourself to be happy to have all your needs met, or is there something something missing that you would like to, incorporate into your life, or something that you would like to that you feel would add to your personal health or wellness?
Hmm. Right now, I just hope that, I'll live longer.
Yep.
The only wish I would love to do is to live longer. My longevity of my life.
Longevity.
Yeah.
Okay. So do you have any ideas in terms of how you're going to improve your longevity?
Probably just taking care of myself, taking healthy foods, eating healthy foods, and continuously take medication that's given prescribed by my doctor. Maintenance.
Take your maintenance, okay.
Yeah. And what else?
Okay. Other than the questions I've asked you, is there anything else that you'd like to talk about that perhaps would shed light on your feelings with regard to your health, wellness, how you plan to continue to achieve your healthy state, or any opinions about healthcare in general?
What do you mean?
Do you have an opinion with regard to um, your overall state of health? How do you feel your overall health has impacted your quality of life?
Oh, my quality of life.
So, for example, although you've indicated that you have seen some decline in your health, overall,
Yeah.
you are healthy.
Mm.
You take care of yourself. You're independent. You still work. So, how has the fact that you've been healthy contributed to your quality of life?
My mind is so bad now.
So you could say, let's say for
My mind
example,
is so I can't even think of anything.
so the fact that you're healthy allows you to still drive. You can still drive. You can still do a lot of things for yourself. Is that correct?
Yeah, I can drive and I can cook. Cooking, I think, is number one for me.
Okay.
Cooking, you know, I could drive myself around, go shopping. I could do that. Shopping, I
Okay.
love shopping.
That's great.
I love shopping.
So do you find time for social activities
Mm,
with other people, within your age group, or
would like get together with my schoolmate back home, nursing school. Like getting together, reunion. That's the only thing now I'm doing. Like we see like once a month or so.
okay.
We see.
Okay, we're just going to pause for one moment. Okay, so we're just resuming our interview now. I just wanted to go back a little bit to our questionnaire, and I just wanted to point out that, or I noted that you became visibly upset at the idea of aging. Now, why do you think that those questions created such a powerful emotion when I asked them?
Yeah, because I don't know, getting older, and still helping family like back home.
So you feel like you still at this stage have a lot of responsibility on your shoulders?
Yes, because we were 10 in the family, and
10 siblings?
10 siblings total, including me, and the rest of my brothers and sisters. Like my eldest sister, she has an accountant, she has a doctor,
Mm-hmm.
and she still need help. I don't know.
Okay. So just so your feelings are of a frustration
Mm,
or a little bit of anger,
yeah, frustration. It's just
frustration.
it's because since I've been here, I've been helping. It's every one of my brothers and sisters, you know.
Yes. Okay. So you've had this caretaker role for how many years now?
Since I've been here. That's since 1972. I've been helping, and I think like it's like never ending.
Okay. Are you are you looking forward to a time where you don't are not responsible for the well-being of
I don't think
all the other people in your family?
I don't think there's an ending for that. So
Okay.
just continuously.
Okay. Okay, so let's talk about a little bit about your um not your siblings, for example, but about um your own your own immediate family members. Okay, so you noted that you share a home with your significant other.
Mm-hmm.
Um, do you have any children?
Yeah, I have two boys.
Okay,
One lives in Atlantic City,
okay,
and the other one here in Clifton.
all right. Now, do you have any grandchildren?
I have four, two and two.
Two girls and two boys.
Yes.
How is it being a grandma?
I love it.
Is there something particular specific that you enjoy about it?
I enjoy. They're beautiful, and they're so loving.
Okay, right. And how would you describe your relationship with your sons?
My relations with my son, to both of them.
Yes.
Oh, it's just the other one is I can, he's he's a nurse too.
Okay, so one of your sons is a
This is a
nurse.
nurse, and the wife is a nurse, and at least they're stable,
Okay,
and they don't need my help.
that's good. And what about your other son?
My other son, he needs help.
He still needs you. Okay, so that just adds another level of responsibility to your already full plate. Okay. Now, just some other questions unrelated to your family structure. Do you have a living will or an advance directive?
No,
Do you think that at any point you would want to pursue one or have one in place?
maybe.
Okay. Now, I know we talked a little bit about your family health history. Um, is there any history of chronic illness in your family?
Um, um, my sister
Okay.
is a chronic asthmatic problem since
Okay.
she was in high school. I don't know how old was she. She wasn't like 18 years old when she had started with her asthma. Until now, she's asthmatic. Is taking so much medication for for her asthma.
Okay. And any history of cancer or or any other autoimmune diseases?
I think my mother had blood disorder, so that was this, when was this? 18 years ago.
Okay. So has she since passed away, or
Yeah.
how old
And
was she when she passed
she
away?
passed away at the age of 79.
Okay. And what about your father?
My father died with he was asthmatic. He died like heart attack.
Okay. And how old was he when he passed away?
50. I don't know how old was 65. I think it was 65 then.
Okay. So he was still relatively young.
Yeah.
Okay. So how did you feel when, um,
When he passed away.
not when he passed away, but I guess the sudden onset?
Yeah, I feel bad because I was just here, like how many years I've been here? Probably I was here for like 4 years here in United States when he passed away, and I felt bad because at least because I always wanted him to come over here to United States.
Okay. Do you think his health would have been impacted?
Yeah, probably it would even help him come over here, take
Mhm.
medication, go to a special
Mhm.
doctor for pulmonary something.
Mhm. Okay.
Maybe live longer.
Okay. Have you ever been hospitalized for any reason?
Mm, just for surgery, not you know,
Okay.
for surgery when I have my bunions
Okay.
and my cataract for my eye surgery.
Okay.
That's the only time I was in a hospital. Oh, when I have my children.
And when you had your children? Okay.
Yeah, that's the only time that I was in a hospital. With my two boys and bunions removed and cataract.
Okay. How often would you say you go for physical with your primary care physician?
Physical for every 3 months.
So every 3 months?
Hmm.
Have you had any preventative diagnostic tests done, such as mammograms,
Yeah,
colonoscopies?
I have colonoscopy and mammograms.
Okay.
Like colonoscopy, I think it's every 5 years now.
Okay. What about your obstetrical health, your gynecological health?
Uh,
Do you see how often do you see an OBGYN?
I've been seen for it for the longest time.
Okay.
Just go for medical, and if I have any problem, then
Okay.
that's it.
So just medical right now, and if a problem arises, you
Right.
can. Okay. Okay. Now you said previously that you were on uh, maintenance medication.
Yeah. Maintenance, yeah.
So what kind of maintenance medication are you on?
Uh, I have the amlopidine, 5 milligrams.
What is that for?
That's for amlopidine for my cholesterol and for my high blood pressure.
Okay.
Simvastatin. It's combination amlopidine and the simvastatin, 5 and 10, I think.
Okay. Any other medications?
Yeah. taking Vasepa
Okay.
for my triglyceride.
Okay.
And what else? I'm taking Kepra. I
Okay.
think that's just when how many years ago? 6 years ago when I was driving home, and like the split second, I pass out.
Okay. Did they ever identify the cause of that?
No, they just they just prescribed me medication for like what do you call it, preventive or
Okay. Preventive measures.
yeah, hmm
Okay.
just in case I have seizures, something like that.
Okay.
And I think that's the only medication I'm taking. Oh,
Okay.
I'm taking. They put me now on what medication? Metformin.
Metformin.
Mm-hmm.
Okay.
Um, for my
So are
sugar.
they monitoring your blood
Yeah.
sugar?
Mm-hmm.
Okay. Do you take any medications that are not prescribed for a doctor? For example, any over-the-counter medications?
Oh, yeah. It's not. It's over the counter, but the doctor told
Mhm.
me to take aspirin 81 milligrams.
Okay.
Mm. And
How
take
about
some multivitamins too.
multivitamins? Okay.
Mm-hmm.
How would you describe your oral health?
My what?
Oral health? Like
All overall?
yeah.
Oh.
You go to the dentist often or?
Oh, for my dentist, yeah.
Mhm.
I go every 6 months. For like general cleaning.
Okay. Now just a question about your family. Now I notice you're very proactive with regard to your own health. Do you also promote those same health practices with, for instance, your significant other?
Yes.
Do you
Yeah.
make sure he?
He takes his medicine.
Okay.
Make sure he take it. Like the
Okay.
same thing for his high blood pressure,
Mhm.
cholesterol.
Now, would you consider yourself a compliant patient?
In between.
In between? So, are there instances where you don't always take the medication as prescribed, or you forget,
Sometimes
or
you forget.
okay,
Sometimes you do your work and you forget you're taking my medicine.
okay,
You said, "Oh, I'll take it in the morning," and then you forget. Well,
okay,
they give you the medication right in front of the mirror.
okay. Right. I think that we are close to the conclusion of our interview. Um, I thank you for being so open and honest with regard to your feelings about aging and also about sharing personal details about your life and your health practices and your health beliefs. If you could kind of give advice to a younger person with regard to the importance of health, what would you say to them?
You have to make sure that if you feel something wrong with yourself, or but that you have to go to your doctor
Mm-hmm.
right away. Go find out what's wrong with you, and you have to take your medication. If they prescribe anything, the doctor prescribe you medication, just take it, and take healthy food, eat healthy food.
Okay, that's very good advice. Just on another note, I'd like to ask you on a personal level. For someone who does take maintenance medications or is on a regular regimen of medication, has cost ever been an issue for you with regard to being able to meet your medical needs? Like, has there ever been a time where you were not able to properly take care of yourself because of financial situations, or?
No, not financial
Okay,
situation.
that's good.
It's just giving, forgetting, taking the medication. You have the medicine there, but you don't take it.
So it's mainly just an issue of just
Forgetfulness.
forgetful or just remembering to take it.
Remember to take it, yes.
Okay. Now, have you ever considered using a reminder or
Yep.
a pill sorter to help
Yeah.
you to remember
Yeah, I
the
have that. Yeah,
medications?
I
Okay.
have a medication sorter. It's in there, but still you forget it.
Okay. So when you forget the whole day's
Yeah,
medications, or
yeah, because everything is there.
everything is in one day?
Yeah, one day, yeah. Monday, Tuesday to Sunday. Everything is there. And you still forget.
Okay.
It's right in front of the dresser.
Okay. Now, just to clarify, you mentioned previously that you're still employed as a per diem nurse.
Yes.
How many hours do you work, either bi-weekly, monthly, more or
Uh,
less?
like 3 times a week, that's 8 hours. So 8 times 3, 24 hours.
So 24 hours within a
In a
month?
month, yeah.
Okay. So about 24 hours a month you still work.
Yeah.
Okay. And do you find that work physically demanding, or um, overall, do you think that is that contributing to any health problems that you may be experiencing, or
No,
no impact?
no impact. It's good. It's still, I know that I can work, and with my health, it's okay.
Okay, so you're
Because
able to
yeah,
manage.
yeah, because that's what my work before. I worked nights, and nothing bothered me. It's just probably sleeping now. You know,
Okay.
you
So
get
is it the sleep deprivation that's
or you
bothering
get
you, or just
tired, maybe tired. You
lack
get
of sleep?
you know